Next, we will be discussing regarding the astigmatism. That's an optical condition in which the refractive power of the lens is not the same in all the meridians, and this most often results from too great a curvature of the cornea in one plane of the eye. The types of astigmatism, that is regular, irregular, lenticular, curvatural, positional, and the retinal. The regular means meridians of the minimal and the maximal of refraction are at the right angles to each other, and in the irregular the meridians are not at right angles to each other. Lenticular is right, then the curvature abnormalities of the curvatural of the lens, then positional tilting or oblique placement of the lens, retinal oblique placement of the macula. The regular astigmatism, the cornea has two different radii of curvature at right angles to each other, and the causes a biological variant due to weight of the upper eyelid resting on the eyeball, surgical incision into the cornea, trauma or scarring of the cornea, tumors of the eyelid or the chalazion. In the irregular astigmatism, the cornea has three or more different curvatures, and the causes a corneal scarring, keratoconus, and variations in radii of curvature of the crystalline lens, and lenticular and astigmatism, minor degrees of astigmatism. These are the different between the regular and the irregular. Cornea has two different radii of the curvature. The right angles of each other is the regular, and in irregular the cornea has three or more different curvatures. The keratoconus means the cornea becomes more cone shaped with the apex of the cone below the nasal to the corneal center. The cornea become more cone shaped. That is the keratoconus. And coming to the symptoms of the astigmatism, the distinct retinal image cannot form. The changes in the accommodation cause symptoms, and the severe astigmatism may cause the optic disc to appear oval rather than near circular. Severe astigmatism may cause the optic disc to appear oval rather than near circular. Then the anisometropia, that is the optical state with equal fraction in the two eyes, is termed isometropia. Optical state with equal fraction in the two eyes is termed isometropia, and the anisometropia is when the total refraction of the two eyes is unequal. The condition is called anisometropia. When the total refraction of the two eyes is unequal, the condition is called the anisometropia. Condition in which the refractive error of each eye is different, at least more than 2 diopters. Means there will be two different power for two eyes. Then it is neutralized by prescribing the appropriate prism in the reading segment and using separate lenses for near and far vision. We have used the prism and lenses for separate vision. Then correction of the refractive errors by use of the lenses. We already see the use of higher glass for the myopia and the hyperopia. In myopia, we will be using the concave spherical lens, and in hyperopia, we will be using the convex spherical lens, and the image will be correctly forming instead of the problem. Then the correction of the optical abnormalities by use of the contact lenses is held in place by a thin layer of tear fluid that fills the space between the contact lens and the anterior eye surface, and it nullifies almost entirely the refraction that normally occurs at the anterior surface of the cornea, and it will be helping to have the correct vision according. We will be using the correct lenses for the particular problem, and we can easily correct this. Then the correction of the astigmatism, it is neutralized by the cylindrical lenses, which are almost a line of focus to form and which parallels the axis of the lens, and hard contact lenses may be used to correct irregular astigmatism, and in keratoconus the corneal transplant should be considered. These are the ways to correct the astigmatism: hard contact lenses and corneal transplant in case of the keratoconus, and neutralize using the different lenses for neutralizing the problem. is the difference between corrected and uncorrected astigmatism. Means any vision problem. If there is a blurred image while we are using the appropriate glasses, then the image will be more clear. Then coming to the presbyopia. The presbyopia is the eyesight of the old age and is not an error of refraction but a condition of the physiological insufficiency of accommodation leading to falling vision for near, and it usually occurs after the age of 40. It's a eyesight of old age. It's not an error of refraction but a condition of the physiological insufficiency of the accommodation and leading to failing vision for the near. Means the people will be complaining of the progressive visual loss. Day by day their vision will be decreasing. Then the correction of the presbyopia, we are using the convex lenses added to the distant correction and weakest possible convex lens to be permitted individual to carry on the different tasks, and trifocal or the bifocal lenses, it requires lenses for distance without changing the glasses. Trifocal or bifocal lenses means it require lenses for distance without changing the glasses. Then coming to the diagnostic, yes, as we are doing all four the things, we will be using the history collection, then physical examination, Snellen's chart, ophthalmoscopy, retinoscopy, and the autorefractometry. These are the different diagnostic evaluations which we are using to identify the specific problems of the eye. Then the surgical correction of the refractive errors, we already discussed two of them. LASIK, that is a laser in situ keratomilias, then PRK, that is photoreactive keratectomy, then radial keratotomy, then INTACs, that is implants within the corneal stroma, then phakic intraocular lens implant or the lens implants in the eye. These are the different surgical options. We have to discuss the INTACs and the phakic intraocular lens implants. All the we are already discussed. The advantages are, in case of the high refractive errors, the errors may be brought down to a more manageable level so that we can be corrected by the other means, and no need of glasses, contact lenses, or no minimum wearing time. Then the disadvantages, all surgical procedures have a static failure rate which may range from improper correction to loss of the eye also. And costly instrumentation and surgery not freely available, and the stringent case selection. These are the advantages and disadvantages of the eye corrective surgeries. The INTACs or the implantable lens means micro thin polymer rig segment will be using and placed under the outer edge of the cornea. In outer edge of the cornea, we will be implanting the newer corneas, that is an INTACs. In the advantages, reversibility, tissue is not removed and the eye is not structurally weakened, delivers an excellent quality of vision. These are the advantages of INTACs. Reversibility, tissue is not removed and the eye is not structurally weakened and delivers an excellent quality of vision. And disadvantages are only approved for low levels of myopia and does not correct the astigmatism. Then the phakic intraocular lens implants. The lenses made of the plastic or silicone that are implanted into the eye permanently to reduce a person's need for glasses or contact lenses, and the phakic refers to the fact that the lens is implanted into the eye without removing the eye's natural lens, and during the phakic lens implantation surgery, a small incision is made in the front of the eye, and the phakic lens is inserted through the incision and placed just in front or just behind the iris. That is a thing what we are doing in this phakic intraocular lens implants. So it's I think it's clear, and once we have go through all these things, we have to be more knowledgeable about the pre and post-operative surgical management, and you have to go through it. Okay, thank you.